I'm David Clayton. I'm a remedial massage therapist in Adelaide, Australia. My business is Myo Masters Massage. We're out in the northeastern suburbs. And we work a lot with people who are experiencing chronic pain. And many of them have had surgeries in the past, multiple surgeries in the past, and are still experiencing pain. The first impression as you work through the techniques is like, this can't be right, it's too simple. Where's the magic? Until you start to see and play with those techniques and see the results. In working with scars in the past, I've stuck to, I guess, safe areas. I might work with a scar on the shoulder or the knee or the thigh, hips. But through the course, you explored some more intimate surgical procedures around the abdomen with breast surgery. And I had never, ever, particularly as a male practitioner, never ever considered working in, I guess, what we would consider to be taboo areas. A core component of the Scar Tissue Mastery course is a practical, and I worked with a C-section scar. That's something I would never have done, before working through this course.
It's Gina from Blossom Remedial. I'm located in Melbourne, and I've got my own business, and I've done a few courses with you as well. So remedial hot stone and scar tissue therapy, which I absolutely enjoyed every second of it. A lot of my clients, they have scars and stuff. They've been going through some surgeries and stuff, and I wasn't sure how this would work and stuff. Since I studied, I've become really passionate about it to work with and stuff. So every time I look at my clients' scars, I'm like, oh, I can do that. I can help. So that's something. It's it changed my career in a good way. So, and my clients are happy. I offer them, and they're really passionate for me to start treating with them. I loved the strokes that you are going through, and it was one of the breathtaking strokes that I ever come across. And I'm like, oh my God, they are so good. And when I tried it on my partner's scar, that was absolutely breathtaking, and I watched it in front of my eyes. I'm like, oh my God, these little strokes really can help.
I'm a acupuncturist and a massage therapist. I've been treating over 10 years now. So I'm based in Sydney, and last 5 to 6 years I've been really interested in more the cosmetic acupuncture and the cosmetic side of massage therapy, because I've been getting a lot of patients with post-surgery, especially cosmetic surgery, like liposuction. So I've been treating, I am a qualified lymphatic drainage as well. The techniques that you provided, it shows that it can be simple, pain-free, painless, and get good outcomes out of that too.
I'm Gemma. I've been in the industry for over 20 years. I operate now currently up in Far North Queensland, which is up in a tiny little village, Mission Beach, which is 2 hours south of Cairns. I did come from Sydney, where I'd worked extensively with quite a few different varied therapists, which was great because it gave me a really good diversity on different clients, which is essentially different bodies and different needs. But I've really enjoyed working up here. I mean, I actually deal with a lot more senior people than I would have before, and a lot more physical working people, as opposed to corporate, which is what I had in Sydney. So as I said, that's got very different needs and therefore different techniques, and also different communication skills as well. My biggest takeaway was the gentleness of the technique. That was probably my biggest aha moment of wow, because I didn't expect that. And then at the effectiveness of that, and also at the speed of the difference of that, of the effectiveness of the change that occurs. I really did like the fact that it was mixed up between practical assessment and execution, like as in seeing the client, get the practice from you and the treatment, and also theory. Obviously the two go hand in hand. And the theory was, I found incredibly interesting. It was really interesting and just really informative.
Did the meetings every week help with that, the live?
Oh, absolutely, yes. The more weeks was going on, I was getting more confident on those areas. Like now I know like how it feels, to the touch, how much the touch should be, like how smooth the touch should be. So it's got solved towards to the mid time of the course. Yes.
And for me, that to me was the most important part of the Zoom meeting itself, was actually, because to me that's the closest thing you get to being in class, is like hearing their feedback, because again they've got different clients, different techniques, different backgrounds, and they're from different parts of Australia, and we all had different levels of experience as well, which again I think was really interesting.
Did you find it quite easy to learn those techniques online? I know that you've already had training and things.
It is quite different to the other course anyway, so it was quite easy to learn the techniques. I guess more with when to use that was just my sort of difficulties. I just had to get around with, okay, better for this type of patient, you have this type of scars, this technique might be better. But again, I think it's more practical. So when I treat with my patients, I build up more the skills and knowledge, this works and what doesn't. But it was, from learning it was, I would say there are different techniques in there, but it's all similar. That it wasn't too hard to forget, or remember.
Do you think about scars any differently? I mean, I know that you were well educated, well versed in scars and international work. Anyway.
So the difference is really broadening what I thought of as being safe to work with, and also just understanding how a person may have received that scar.
I'm so passionate about scars now. Like every time, like when I meet even my new clients that for the first time I'm going to them, and if I see any of them has scars, my eyes is looking around. So I'm like, when I see, I'm like, oh, I'm a scar tissue therapist, I can help.
A bit of a scar stalker. Like when I meet people, I see they've got, like when any of my friends, I'm like, oh, when did that happen? What's that for? I just can't help but see them everywhere now. And I'm looking at them wanting to, like, oh, how does it feel?
You just want to touch them now.
Yeah, I know. So I mean, it's like, oh, scars, So, it's funny, really. But I'm sure that's probably like a lot of things. When you learn it, all of a sudden you're going to see it everywhere.
If you want to become confident and comfortable in working with scars, you need to do further training. This is the only training that's available in Australia that I'm aware of. And you can learn it from the comfort of your own home. You can do it around your other clinical duties, and you've got access to it forever. Once you've undertaken that training, you can keep on coming back to it.
Well, I definitely recommend the course because it is 7 weeks, so it is spread out the load, and because it's online as well, like you said, we have busy days during the day with our treatments. At night, try to jump on, watch some videos. Some videos were long, some videos were short, but I can get through them, especially since it's online. You can do it at your own time. If you have kids in that, just after the kid goes to bed, just watch it, or early morning, or when in between breaks, you can be able to pop on and watch. I found that was really helpful, and because it's 7 weeks, it's more detailed, especially I guess for therapists who's already treating. That I did find it was helpful because I was already treating patients as well. So while learning this, picking up the skills, I was able to use it while learning and treating the patient at the same time.
I can imagine that the biggest challenge in people's minds is, how am I going to learn the technique from a visual basis only? And all I can say is, I think, because, you're talking about 5 to 6 different techniques, I think, off the top of my head, and they're all gentle. So that's very doable. Like, it is doable. If we're talking like 20 to 25, then I'd be like, I'd probably be a bit more, reluctant. But yeah, no, I think also because we are experienced practitioners, then that's what makes it an entry, that makes it much more accessible.
I am so lucky to have you as a trainer that nobody could ask for. You're the best trainer in the world. As I said before, and I will not ever stop saying that.